The lack of food literacy consumers have is one of the biggest reasons as to why New Zealand is ranked the third obese country in the world. Consumers simply do not understand what is in their foods. This campaign is designed to give consumers a better understanding of what they are consuming by following the educate, prevent, reduce steps. Furthermore, these steps would help improve the lifestyle of New Zealanders, and in addition improve New Zealanders' obesity percentage.
The first part of this campaign is educating stage. Mandatory classes in school is necessary now. It is important for early education to teach the school about the food literacy, especially through the support of the government for a certain period of time. Every day, the choices that we made about the foods that we are going to buy and eat impacts our own health, the health of our own community, and also the environment supporting. However, this food literacy educating program is showing amazing low cost and very high impact opportunity. Due to the data and surveys, the most common community benefits witnessed by food literacy educators have been increasing home-cooked meals, increased hydration, and kids having more fun in kitchen, which eventually increases the food literacy in good chance starting from young age.
Second stage the campaign would work on is preventing, which is closely linked to the educating stage. They would cover the preventing stage by simply giving guidelines as to how to read food labels, as an example is shown on screen, and what exactly to look out for and what to avoid in food labels, as also shown on screen. This is highly important because nowadays brands mislead their food labels by quoting sentences like low sugar, low calories, or low fat in big bold letters on the front of the product and in their advertisements, when really it means something different. This leads to confusion if consumers follow by these claims. Another way the preventing stage can be covered by the campaign is by giving consumers an insight on why they should eat healthy and why it is important. We're constantly being told to eat healthy because it's supposedly good for us, but we're never told why and how it's good for us. These ways of covering the preventing stage can be done through posters in supermarkets, advertisements shown on TV just before normal dinner time, and articles in newspapers. These strategies would ensure a good proportion of New Zealanders are receiving the message. Therefore, the lack of food literacy within consumers is prevented.
The reduce section of our project is aimed at reducing the sugar levels in products and reducing the quantity of unnatural foods consumed by individuals. High levels of sugars has been proven by health professionals to contribute not just to rising levels of obesity, but also other health conditions such as diabetes, heart disease, dental cavities, and cancer. Our project will push to pass a government regulation which restricts the quantity input allowed of sugar ingredients in our natural foods. This will be done on a sugar per gram or milliliter restriction for producers to comply with. The second part is relying on government funding on natural foods sold on the shelf. As natural foods are rising in price due to a lack of production, this funding will pay producers a proportion of what the goods are worth in order to lower the price of these natural goods. As takeaways and sugar-bound natural foods have become so cheap in price, this government funding will make healthy natural foods relatively more affordable for consumers. This is aimed to improve individuals' diets by giving them healthier options on the shelf and encouraging them to cook healthy meals instead of buying takeaway and consuming a large quantity of unnatural foods.
It is essential the campaign includes all three steps of the long-term process, as they all play a big part in improving consumers' food literacy. Educating being the first stage, preventing closely linked by, and finished off with the reducing stage. In result, this would benefit New Zealanders' lifestyles and lower New Zealand's obesity percentage.